This is Radio Health Journal. I'm Nancy Benson. This week, why the rules of war often don't protect hospitals and healthcare workers.
You have to distinguish between a health facility, a hospital, or a clinic, and a military object. And you have to take steps to minimize harm. But it's inconvenient.
How war affects healthcare when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
When you are defined as your roles, what ends up happening is that we often lose ourselves, we lose our identity. For years, I wasn't called Eve anymore. I was just called Zach's mom.
Understanding the many roles we play in life. Then,
squeeze, I feel like a term I picked up when I started really getting into conventions, and squeeze is to be so excited about something that you can't contain it.
Appreciating the geeky world of fandom. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
It's long been said that all is fair in love and war, but that's not exactly true. In times of war, some places are supposed to be off limits.
There are actually very strong rules about how warfare is to be conducted to protect healthcare. For example, you have to distinguish between a health facility, a hospital, or a clinic, and a military object. And you have to take steps to minimize harm to a health facility. That's very clear in the law. But it's inconvenient. And so you see all over the world that even countries that say they want to adhere to international law don't do it.
That's Leonard Rubenstein, professor at the Johns Hopkins Bloomberg School of Public Health and the author of Perilous Medicine, The Struggle to Protect Healthcare from the Violence of War. He says healthcare facilities and workers are targeted in wartime far more often than most people know.
Over the last 5 years, ending in 2020, there was an effort, a successful effort, to record the number of acts of violence against healthcare in conflicts around the world. And there were more than 4,000 incidents found. And what that really amounts to put it in an understandable perspective, is that on average, every 2 days, a healthcare facility was damaged or destroyed. Every 3 days, a health worker was killed. So given the need for health services around the world, the fragility of these health systems in conflict regions, the destruction and the forced migration of health workers because of the violence is of extreme concern.
Those numbers are bad enough, but experts say it's likely a significant undercount of the actual number of attacks and deaths among healthcare workers and their facilities.
It's very difficult to document these events, and there are many countries, especially where there's little access of the media or human rights groups or others. Reporting is very difficult. And often healthcare providers are very reluctant to report because they're concerned that if it is reported, they'll be attacked again.
And when the attack itself doesn't decimate the local population, the after effects just might.
A prime example of that is Yemen, where the Saudis started a war in 2015, which the United States actually supported through arms shipments. And they didn't distinguish between hospitals and military installations, and effectively destroyed the health system. They destroyed the water system. It all led to a cholera epidemic, the largest in the world ever recorded, 2 million people affected. So there are many of these drivers of the violence, and we have to address all of them.
One major factor is disagreement over just what neutrality means. Healthcare is supposed to be seen as neutral in an armed conflict. However, military strategists may view doctors as the enemy if they're patching up opponents or local residents who are potential opponents.
Well, I'll give you an example. There was a war. There's intermittent war over 50 years in eastern Myanmar between factions representing the ethnic populations in that part of the country and the government's army. And the groups of health workers, itinerant health workers that went from village to village trying to provide health care because the government wasn't in the conflict regions, were attacked. Clinics were burned. And at one point, colleagues and I interviewed some of these health workers, and they told me things like, if they find out I'm a health worker, they will arrest me or kill me. It's because they're health workers, in fact, that many are targets. And we see this in Syria as well, where more than 600 hospitals have been attacked by missiles and shelling. Almost 1,000 health workers have been killed in Syria.
Warring sides often justify attacks by claiming healthcare workers have given up their neutrality and working for the other side.
That claim is all too common, but it's wrong, if I can put it bluntly. You think of a military physician who's wearing a uniform, and no matter which side they are on, no matter who they're affiliated with, you can't expect them to be neutral. You can't expect them to be ethical. And being ethical means you provide care to whoever needs it, regardless of who they're affiliated with and what their beliefs are. So they're impartial, just like all medical personnel are impartial. But there's no requirement in the law to be neutral, and we know they can't be neutral, just like neither a military doctor nor a Syrian doctor who's a sitting duck in a hospital that's being bombed can be expected to be neutral. But it's not required that they be neutral.
Another factor, Rubenstein says sometimes armies loot hospitals to steal supplies or kidnap healthcare workers to provide care for their own forces rather than the other side.
Sometimes they demand priority in treatment, even though under normal medical rules they wouldn't be entitled to priority. Sometimes they'll even kidnap health workers to bring them to their own cadres, or their own colleagues, their own fellow combatants to provide care. So there are tactical reasons as well.
That's all against the supposed rules, but a lot of regimes simply don't care.
I think ISIS is a good example. They don't follow Western law at all, but there are exceptions. Even in Syria, where I said how many hospitals were bombed, they claim to follow the conventions, but of course don't. And they claim they're fighting terrorism and that terrorists are hiding in hospitals. So they recognize what the law is. That's really our only hope. The hope is that these rules and the values that are underlying the rules are, with the exception of really radical groups, widely recognized to be widely accepted. And that, to me, is the point of leverage we have to force compliance.
That all seems to be a gloomy picture, but Rubenstein is optimistic that the leverage of international organizations and governments may have an effect in turning down the attacks on frontline healers.
It is a tough nut to crack, but we do see some rays of hope. You'd be surprised to learn that even groups like the Taliban were very sensitive to human rights reporting about their conduct, and they often filed written response to human rights reports by the UN, which showed that it mattered to them that they were seen as legitimate. Now, that wasn't perfect. They committed many violations of human rights, including against healthcare. But it's another glimmer that there are ways of changing behavior. And of course, is accountability. We have many institutions for accountability, and we just have to use them.
All it will take, Rubenstein says, is some leadership. Attacks on healthcare facilities may seem like something that happens only in countries far away, but he says they still affect us. Leonard Rubenstein's book, Perilous Medicine, is available now. You can find out more on our website, radiohealthjournal.org. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
If your scientist says one thing and my scientist says another, who's to say who is right? And so it is this slow erosion of facts.
doctors who spread lies about COVID. A little bit goes a long way.
Then needle phobia. A surprising number of people avoid doctors completely because of it.
I knew that if she reached up to pull that cord to indicate we're getting off the bus, I was going to get a shot, and I would go berserk.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.